Good afternoon, sir. My name is Avilia Suechimando.
And as of filming, it is currently October 24, 2025 at Friday.
And the procedure we will be performing today is called the infant bath procedure. But before we can get into the procedure itself, let us first define what it means. So, an infant bath procedure is the process of safely and effectively cleaning a baby to promote hygiene, comfort, and bonding. It is a fundamental part of newborn care. The procedure varies slightly depending on the age of the infant, with different techniques used for newborns and older babies. So now let us move on to the purposes of infant bathing. So there are numerous reasons why people will bathe their infants. So firstly among them is hygiene. It helps remove dirt, sweat, and bacteria from the baby's skin, which prevents rashes, irritation, and infection, especially in the skin folds. Then we have bonding. So bath time can be a calm, nurturing routine that strengthens the emotional bond between the baby and the caregiver through touch, eye contact, and gentle communication. Then we have relaxation and sleep. So a warm bath can help soothe a baby, making them feel secure and relaxed, often helping them sleep better. And then next we have skin health. So regular bathing helps keep the baby's skin healthy, but it should be done with gentle products to avoid dryness or irritation. And then next we have routine building. So incorporating baths into a daily or regular schedule actually helps babies to structure and adapt to predictability, which is important for their development. And then next we have developmental stimulation. So the sensory experience of water, its temperature, movement, and sounds will actually help the sensory and the cognitive development of the infant. So now let us discuss the essential equipment and supplies needed for an infant bath. So first we have a baby bathtub. So we need a small plastic tub which is designed to safely support a baby during bathing. Some models come with anti-slip features or built-in seats. Next, we have the cotton wool balls. So we need this to clean for the eyes. And then next we have bin or plastic bag. So for soiled cotton molded balls. And then mild baby soap and shampoo. This needs to be gentle, tear-free, and fragrance-free products made specifically for a baby's delicate skin and eyes. And then we have a soft washcloth or a face cloth. This is for gently cleaning the baby's body and face without irritating the skin. And then we have the soft-footed towel and bonnet. This is a cozy absorbent towel with a hood to keep the baby warm and dry their head quickly after the bath. And then next we have baby clothes, clean diaper, and a baby wrap. So we need to have them ready nearby for dressing the baby immediately after drying. And then next we need a jug of water or cool boiled water or sterile water. So we need to pour warm water over the baby for rinsing off soap and shampoo. And then we need a bath thermometer. This is not necessarily needed, but it is recommended. So this is to ensure that the water is at a safe temperature, which is ideally around 37.38 degrees Celsius. And then we need baby lotion or moisturizer, again, optional. So this is for moisturizing the baby's skin if it tends to be dry. And then next we need a non-slip bath mat or a towel for surface. So this is to prevent the slipping if you're bathing the baby on a countertop or a flat surface. Next we need baby wipes. So this is to clean the buttocks. This entire procedure is estimated to last about 5 to 10 minutes. So now let us move on to the procedure itself. So, firstly, you need to assess the family's preference or fit bath time into the family schedule. So every family has its own schedule, and as nurses, we need to respect that so we do not cause any unnecessary disturbance in the routines of our clients and subsequently cause them much stress. The next thing that we need to do is to assess and check the infant's body's temperature prior to bathing. So this is necessary because we need to check if the infant is not experiencing a fever before we give them a bath. That is because if the infant is experiencing a fever, it is more recommended by numerous articles to instead give them a lukewarm sponge bath to bring their temperature back to its normal values. So the normal values of temperature in an infant is usually 36.6 degrees Celsius or 38 degrees Celsius, and you need to take it using a thermometer. Next, prepare all needed materials. So this is to prevent unnecessary movements when you are doing the procedure. So you can focus your attention on watching and bathing the infant.
So this is our basin for the bath. And then we have the towel for drying the baby. And then the face towel. Then we have the cotton balls. And then we have the baby's clothes, the baby wrap, and the baby diaper. However, this diaper is too big for the baby model, so we will be improvising a baby diaper to fit the baby dummy. And then we have the bath blanket to prevent sleeping. Then we have the bonnet to keep the baby warm, and its hood blanket also to keep the baby warm. Then we have the container for the soap and the bin for the soiled cotton. So these are the materials gathered together.
So now I am going to be performing the hand hygiene procedure. So, after you have performed your hand hygiene, the next step that you are going to do is to introduce yourself to the client. So, you have to introduce yourself to the client so that you can build rapport and create a smooth patient nurse relationship. So, assuming that my client is over there and out of frame, I am going to be introducing myself. So,
Maayong adlaw, ma'am. Ako po si Nurse Azelia Sue Chimando. At ang himuon ko po karon is ang pagligo sa imuhang anak. So after you have introduced yourself to the patient, you are going to verify the patient using at least two identifiers. So could be their name or their birth date or their patient identification number on their wristband or such. So this step is necessary so you do not mistakenly perform the procedure on the wrong client. So, ma'am, bago po ako muumpisa, pwede ko ba mangayo sa imuhang pangalan? Ay, okay. So, kanusa ka po napanganak? Kanusa po napanganak ang imuhang anak? So, okay. So after you have correctly identified that you have the right patient, you can now move on to the next step in the procedure, which is to explain the procedure to the patient and significant others to encourage the person to participate as appropriate. So this part is necessary so that you can obtain the patient's informed consent and so that the parent or the guardian can do the bathing themselves to improve their bonding with their child. So now I'm going to be talking to the patient. So ma'am, like ang giingon ko ganiha, ang himuon nato karon is ang pagpaligo sa imong anak. So, importante po ni ma'am para maiwasan ang sakit at para malimpisad ang imuhang anak. So, okay po ba na sa inyo ha? So, after you have obtained their informed consent and you ensure that they have no questions or clarifications, you can move on to the next step, which is to close the room door and or curtains around the bed if possible. So this is to provide privacy for the client and the infant. So this is especially important to respect their dignity as a patient. So I am going to be closing the curtains and the door. So now that you have provided the appropriate steps to privacy, the next thing that you are going to do is close all the air conditioned or fans. So this is important because you are going to be performing infant bathing, and the cold air coming from the fans or the air cons is can cause the baby to shiver or feel extremely cold after the bath. So in order to maintain a safe and warm and comfortable environment for the baby, ensure that the air cons and the electric fans are closed beforehand. Um, there is no, as of the moment, I am not using any fan or air cons as per the procedure. So the next thing that you are going to do is preparing the bath for the infant. So the first step to that is fill the basin with lukewarm water, filling it 1/3 level of the tub, and check the water using the elbow. So this step is necessary because you want to ensure that the water is comfortable enough for the baby. You have to use your elbow because the skin on the elbow is sensitive enough that it can give a better indication if it is safe or a comfortable level for the baby.
So now I am going to be pouring the water in. So this should at least reach 1/3 level of the basin. You have to keep adding until the appropriate temperature, and make sure that you are using sterile water.
Test the temperature of the water using the pump. As I check it, it is at the appropriate temperature for the baby. So After you have filled the basin with lukewarm water, the next thing that you are going to do is place 2 drops of baby soap and water within the water and then mix it well. So this is necessary because you want to ensure that the water is well mixed for easy lathering and easy rinsing. So the next thing that you are going to have to perform is to place the baby on the bath towel and gently remove the vest. You have to place the baby on the towel to avoid the baby from slipping. And you have to gently remove the vest so that the necessary skin is exposed for bathing. You have to put the baby down gently. Okay na baby. And then we are going to have to remove the vest. Baby. Make sure to talk to the baby during the procedure so that they can feel more at ease. Hi baby. Hello baby. Okay lang na? And done. And the next thing that you are going to perform is to remove all clothing, leaving the diapers on, and wrap the baby with the towel, leaving the baby's hands and feet wrapped inside the towel. So this is necessary because you want to expose the skin that needs to be exposed during the bathing process for easy of reach, and then you have to keep the baby's hands and feet wrapped within the towel so that they can feel more comfortable with that certain position and procedure so that they do not feel too exposed. And we are going to remove the clothing. Leaving them with their diaper on.
So you have to
So wrap them with their hands and feet. So after preparing the baby's bath, the next thing you're going to do is clean the baby's eyes. So wipe the eyes using a cotton ball moistened with cool boiled water and squeeze out the excess water. Clean the baby's eyes starting from the inner to outer canthus. Use a new piece of cotton balls in each eye and clean in one stroke. Observe for any sticky or yellowish discharge around the baby's eyes and report it to the charge nurse. So you need to clean the baby's eyes during an infant bath to remove normal eye discharge, lint, or any debris that can accumulate and cause irritation or infection. So the next thing that you are going to be wanting to do after cleaning your baby's eyes is to clean the baby's face ears, and neck. So you have to dip the washcloth, make a mitt, and wash the face and the ears and the neck. And then dry all areas thoroughly. So this is important to wash the face again to maintain the hygiene of the baby, get rid of any debris, dirt that can possibly cause infections or illness. And then you have to dry all areas thoroughly because wet surfaces tend to attract bacteria. Not only that, it is uncomfortable for the baby to leave their face wet. So dry their area so that they can feel comfortable and to keep them safe from pathogens. So the next thing that you are going to do is to be cleansing the baby's hair. So carry the baby using the football hold with the palm of your hand supporting the neck and the head and tucking the baby between your arm and the side of your body. Tilt the baby's head slightly backwards over the basin and wash his hair. So this is necessary. This is all necessary to do to be able to wash the hair of the baby in a secure way by holding them in the football hold. So the next thing that you are going to have to do is to place the infant on the towel and dry the head using the corners of the towel. Unwrap the baby and remove the diapers. If the baby is soiled, clean the buttocks area with wet wipes. Wash your hands after cleaning, especially if he has passed motion. So this part is necessary, especially because you want to be able to remove the towel for easier access to the baby. And not only that, you have to perform your hand hygiene so that you can avoid recontaminating the baby again after you have washed him. So after that, you have to position your left hand under the baby's shoulder to support it. And then secure your fingers under the baby's armpit to have a good grasp. Slide your right hand under the buttocks and grip the baby's thigh and lift the baby and slowly lower him into the bathtub. So the rationale behind this step is to ensure proper body mechanics while carrying the baby in a way that guarantees safetyness uh, and reduces the risk of the infant slipping from your fingers and causing a possible injury or accident. So the next step to that is to allow the baby to sit in the tub with your left hand still supporting your baby's shoulders while keeping your baby's head above the water level. Release your right hand grip and bathe the baby from the front to the private area with the help of a face cloth. So this part is necessary, especially when like supporting the baby with your left hand is to ensure that the baby does not go below the water level and that they remain above the water to prevent from water from entering their um, mouth or stinging their eyes. And then you use your right hand so that you can use your left hand to support the baby and your right hand to wash the baby's body. So once you are done, use your right hand to take over the grip under the baby's armpit and allow him to lean forwards over your right arm for support while you clean the back and the buttocks with your left hand. Talk and sing to the baby to make bath time enjoyable. So this is so that you can ensure that you have the proper body mechanics to prevent the baby from slipping below the water level when washing their back. And you have to talk and sing to the baby to make sure that the bath time is enjoyable for the baby so that they do not cry excessively or and wriggle and possibly cause them to slip. So once you're done washing the back and the front of the baby, the next thing that you are going to want to do is to lift the infant out of the water and place the infant gently onto the towel. Dry the baby's body gently and thoroughly. Pay attention to the skin folds and be sure to dry behind the ears. In between the fingers and the toes, under the armpits and the private area. So this is particularly necessary because you want to ensure all the possible areas in which the skin might crease is completely dry, so that it will not invite any bacteria or microorganisms, as they are attracted to wet water, and cause either bad odor or infections or illnesses. So the next thing that you are going to want to do is cleaning the umbilical cord. Before dressing the infant, be sure to clean the umbilical area with cool bottled water. If you noticed any bleeding or foul-smelling discharges, re-clean the cord and report it to the charge nurse. So, of course, while you are cleaning the umbilical cord of the infant, you also have to be assessing to see if there is any abnormalities that may indicate that there is an ongoing infection or something worse, um, in the umbilical cord days after the baby is born. And then the next thing you're going to do is to wash your hand before cleaning the umbilical cord. Use cotton balls dipped in cool boiled water and squeeze dry to clean the base of the cord with one circular motion. Discard the swab after use. Then, with a clean swab, clean the side of the cord from the base upwards, each time using a new piece of swab. Close the cord clamp and tip the cord. So, of course, before you are going to touch the umbilical cord, you're going to want to wash your hands, especially as this is a specific part of the infant that can very much introduce pathogens or microorganisms within the infant system. So, it's always important that you have to cleanse the cord, and then use your cotton balls. Make sure not to reuse the cotton balls when you are going to wash it in cool boiled water, so that it will be in a safer temperature. And then squeeze dry for no unnecessary moisture, and then clean the base of the cord with one circular motion, and ensure that you're doing it in a single stroke. Don't repeat again and again with the cotton swab, as it can increase the risk or potential for infection. Unfortunately, the baby that I am using for this video does not have an umbilical cord attached, and so I cannot demonstrate as to how I am going to wash the umbilical cord. But assuming that there is an umbilical cord on this baby, I'm going to be using my cotton balls and then dipping it with water, and then assuming this is the base of the cord, you are going to hold it using the cord clamp, and then you're going to wash from the base in a circular motion, and then every time you're going to return back to the you have to take a new cotton ball to start from the base and circular each time, and then after that you have to clean the cord clamp and the tip of the cord, of course, to um, reduce the risk of introducing pathogens that may cause infections. So the next step after cleaning the umbilical cord is to clean the genitalia. So for a female infant, separated labia and with a cotton ball moistened with cool boiled water. Cleans downward on one each side. Use a new piece of cotton ball on each side. For a male infant, retract foreskin and gently cleanse the glans penis with a cotton ball moistened with cool boiled water. So for cleaning the private area of the baby, you have to somewhat apply what you learned in the perineal care. And that is by never allowing the same cotton ball to touch the skin or the private area of the baby twice. Twice. So it is necessary that you use a new cotton ball each time. So, so the baby dummy that I am using for this video does not come attached with private parts. So I cannot accurately demonstrate how to wash the private genital area with the baby. But instead I am going to improvise. So since I cannot particularly show the way to wash the baby if it has a penis, I am going to show how you will wash the labia. So assuming that there is female separated infant labia on the dummy. So you have to follow the principle of cleanliness to dirtiest. So the next step after you cleanse the genitalia of the baby is to dress the infant. So do not overdress the infant. Wear clothes that is comfortable for the environment. You may apply lotion before dressing the infant, but baby powder is not encouraged. Cuddle the infant often for reassurance. So the purpose of this is so that the baby can be sufficiently warmed by the clothes that they are wearing, especially after just after having been given a bath. And then you will apply lotion, though it is again optional, especially if the baby has experienced dryness. And then do not use baby powder because studies have shown that baby powder may actually have carcinogens that can cause cancer to the baby. So it is not encouraged. And then cuddle the infant often for reassurance. So cuddle the infant because you want to ensure that the baby is soothed, because the bathing is a particularly um, taxing activity for the baby. So soothe your baby after you are done with after you are done dressing the infant and washing the infant. Time to take a bath. So lastly, what you want to do is to document the body temperature and the time the procedure was done. So this is necessary to ensure that the baby is not experiencing any signs of hypothermia or fever after the procedure. And then always document the procedure. Always document what time it was done, the day it was done, and the procedures you have taken to not only protect your license but to also provide a frame of reference that other healthcare professionals on the health team will use when they are caring for the baby. So it is also to ensure the continuity of care.